first of all, I have to say thank you very much for joining with us in this symposium. I wish that you all enjoy with the brilliant talks from Dr. Moade and Dr. Kotari. So I'm going to follow up the same topic, and here I will especially put an emphasis on the issues regarding aging and oral feeding behavior. Now, this is a picture taken around 13 years ago when I started my PhD work at the Center of Functional MRI of the Brain at Oxford. My colleagues, you see this whole bunch of people, they are neurologists, neuroscientists, and computer scientists. But I'm a dentist. So frankly speaking, people don't think brain and the teeth, they are highly relevant. So we are just from different worlds. And yes, we are fundamentally different. Dentistry has a very long tradition of surgery. Now, this is what we have learned from the first textbook of dentistry around 300 years ago from Pierre Fauchard. Since then, the focus of dentistry is about the teeth and the oral tissues. So following this logic, to fix the structural deficits of our oral cavity is the foundation of everything. It does not imply that better teeth is better for chewing and better for everything. Now, for the brain scientist, we thought that the patients also need to learn or relearn how to use their teeth. They need to tap into their brain functions for chewing and swallowing, such as attention processing or sensory motor integration. So, in addition to study the stomatogenic system, maybe we need to study the brain as well. And one of the major tools that we used to study human brain is the magnetic resonance imaging, the MRI. Now, the first question that we might ask is that, is the neuroimaging based on MRI a popular method in dental research? In the past 20 years, we have more and more studies published regarding neuroimaging and oral neuroscience oral functions, including pain, chewing, swallowing, dental anxiety and fear, and gustation. Now, all these fields showed a significant rise in the number of publications in the past 20 years. Now, one of the biggest strengths of the MRI-based neuroimaging is its versatility. Now, that is, you can use the same MRI scanner to investigate different features of the brain. For example, you can quantify the structural signatures, such as the gray matter volume of different brain regions, or the functional signatures, such as the intrinsic functional connectivity between different brain regions. Now, but keep in mind that the signatures presented to you are limited by several factors, such as the spatial resolution of imaging, and the functional signatures can be limited by the temporal resolution of imaging. So just like any experimental method, there's always a limitation from the hardware. But I will raise the point that the biggest challenge is how to interpret the data from neuroimaging. Now I'm going to give you an example. You can see here, aging is associated with the decreased cognitive performance and the decreased total gray matter volume. So you might think that cognitive decline is associated with the atrophy of the brain. Well, that is not very surprising. And now we have the evidence that aging is associated with a declined chewing performance. Well, now can you deduce that the worse chewing, the smaller motor area? Can we say that poor chewing is the reason for brain atrophy or vice versa? Now, I want to highlight this at the very beginning. It's very difficult to solve the causal relationship just from an MRI result. And this is why we also need the evidence from animal study and clinical research, especially with the pharmacological intervention. All these research methods are the pillars of oral neuroscience. Now, we are going to go back to the clinical questions. A central theme of my research is that the individual performance of oral sensory motor function is associated with not only the variation in the stomatogenic system, but also with the variations in the brain. So both the brain and the stomatogenic system would collectively relate to one's oral sensory motor function. Now, I would say again, to fix the structural deficit of the stomach system, well, that's very important. But in addition to that, I will focus on the part functional adaptation, which I believe the brain will play a key role. Now, what does functional adaptation mean? Well, you can simply define it as the procedure of learning, that is to refine the association between the sensory input and the motor output, and such a learning is adaptive to an environmental challenge, such as tooth loss. So why is it a critical issue for aging? Because we have much evidence showing that in older people, the individual differences in adaptation is critically associated with the brain. Now, compared to the younger people, older people have fewer brain resources to cope with the environmental challenges, and this may result in a problem in behavior adaptation. Now, at the level of brain mechanisms, I think we need to consider the mechanisms about learning and adaptation. Now, when people are learning a new motor skill, the prefrontal cortex, the secondary motor area, and the cerebellum will show a distinct activation. The prefrontal cortex is crucial to cognitive processing, such as to pay attention to a movement, to switch from one movement to another, and to monitor the progression of a movement. The secondary motor area consists of the supplementary motor area and the premotor cortex. They are critical to learning and a new motor skill, which can be guided by an external cue or by your internal memory. The cerebellum is critical to integrate and fine-tune the sensory and motor information, and eventually a movement can be automatically performed. So I will argue that these cognitive processing and learning may be the key for older people to maintain their oral functions. Now, I will show you some evidence about the brain mechanisms of mastication. Now, first of all, it will not be very surprising that chewing is associated with the brain activation at the sensory motor area. Well, we have already learned much of this from animal research, which is consistent with the result from a meta-analysis of 13 MRI studies of human chewing. But not just the primary sensory cortex. Here is one of the earliest MRI studies of chewing. The researchers found that when chewing a gum, the older subject showed a similar activation at the sensory motor area as the younger subject. However, the older participant showed an increased, not decreased, but increased activation at the prefrontal cortex. And in our lab, we found that in the older subjects, their masticatory performance was positively correlated with the gray matter volume at the prefrontal cortex. And finally, swallowing performance was positively correlated with the volume of the posterior cerebellum. Now, these are the regions associated with learning and adaptation. And we can also find some evidence from the connectivity between brain regions. In the meta-analysis of chewing, we can see that sensory motor area showed a co-activation with different brain regions, including the prefrontal cortex and the cerebellum. And this pattern is specific to chewing, but not to clenching. And we try to identify the brain connectivities associated with masticatory performance. Here, you can see a different pattern of the connections between the older and younger subjects. And finally, if we look at the functional connectivity of the whole brain, that is the whole brain connectomy, now you can see that there is a stronger connection between the prefrontal cortex and the sensory motor modules of the orofacial part. So all these findings suggest that chewing is associated with the connection between sensory motor area and the brain regions of learning and adaptation, and there may be an age-related difference in this pattern of brain connection. Now, I won't say that those findings really answered any questions. In fact, what the dentists want to know is how the neuroscientific findings help our clinical job. Now, for example, when I install a new denture to the patients, well, some patients can quickly adapt to it, but the others cannot. Well, they just cannot eat well, even though, my denture is perfect. So how can we help them? We do need a translation between the neuroscientific findings and the clinical questions. Well, in fact, regarding the mechanisms of learning and adaptation, we have already got some experimental paradigms from neuroscience. Now, if our question is how the individuals can tackle with the difficulty of chewing, then we just introduce some interference and see how they deal with it. For example, in the study of motor learning, we can observe how the subjects get used to the interference when they are reaching a target by hand. We can adopt the similar design intraorally. For example, we can introduce some interference for the subject to chew to see if they can get improved from the interference based on the objective assessments such as masticatory performance or jaw motion tracking. Now, using this task, we may differentiate the people who can quickly adapt to the interference and those who cannot. Then, the next step is to investigate the factors behind that. Now, for example, some people may use more sensory feedback than the others. Some people chew better because they perceive the size and the texture of the food better. And some may take more attention or working memory better than the others. Well, I believe this information would be helpful for dentists to develop a better individualized treatment plan. And I'd like to point out one of the greatest strengths of neuroimaging is to study the mechanisms of human emotion and motivation, which has been always a popular issue in cognitive neuroscience, but very few dentists focus on these issues. However, if you ask your patients about their experience about a new denture or new implant, I believe they have much to say about the emotional and the motivational things about their eating experience. Now, on the one hand, chewing may bring the feelings of satisfaction and cheer, and that means increased hedonic value, and that is, the behavior is rewarding, and people are motivated to do it again. And just in the recent review from Professor Iwata and Professor Cecil, they mentioned that this feeling of reward may play an important role in sensory feedback, such as taste. Now, on the other hand, if you cannot chew well, that would be something really bad. You may feel much frustrated and depressed, and sometimes it can lead to anxiety and fear because you can be very nervous about something wrong happened during chewing and swallowing. Now, I think we have much to do on this topic, and neuroimaging is very useful tool here. For example, we have already known that the reward network, which is dominated by the dopaminergic system and the prefrontal cortex, showed an age-related difference. So neuroimaging may be a good tool for investigating this emotional and motivational experience of patients. Now, aging itself is also a dynamic process. So to delineate the age-related effect of something, we may need more longitudinal evidence, which is able to contrast the difference of declined functions between those who with normal aging and those who with a real oral dysfunctions. Now, for example, okay, this is just hypothetical. Okay, I will not be surprised by the findings that edentulous people show the lower prefrontal functions during chewing compared to the fully dented people. Now, what will be more interesting and more helpful for dentists to know is that their brain stomatogenesis features will predict what happens in the future. For example, in this cartoon, the fully dented people with a good prefrontal function will get improved when installing a new denture, but the edentulous one with a poor prefrontal function will not be benefit from the same treatment. Now, in this case, we know other rehabilitative methods may be required. Okay, so here is the final summary. First of all, I hope that I can convince you that oral sensory motor functions is associated with not only the oral structures, but also with the brain functions. Now, secondly, the neuroimaging evidence has revealed that mastication is associated with the brain signatures of the prefrontal cortex, the premotor cortex, the cerebellum, and they may play a key role in sensory motor learning and adaptation. Now, and finally, the emerging evidence suggests that age-related differences in oral functions may be associated with these brain regions, and they are also critical to learning and cognitive processing. Now, finally, I would like to give my thanks to the people who supported our research, including my long-term collaborator, Dr. Jingyi Wu, and my assistant, Xiaohan Lin, and also the support from Professor Alan Minglun Xu. These works are financially supported by the Ministry of Science and Technology, Taiwan.